First of all, I want to thank Michelle for inviting me to come here. So then I've never been on a low carb cruise. So I get here and I get to listen to Mary and Mitzi. I get to see Bronson, Natalie, then Maria and Tony, and then Michelle this morning, and also Elena. And so, what the hell, girl? I got to follow them. Well, I can tell you that although I haven't been, I guess, wholly invested in low carb, I've kind of made it a lifestyle. I had a mother that was kind of that way. Plus, I was a high school and a college wrestler, so I was kind of weight obsessed. And then when I got out of wrestling and was going to school and working nights and all those things, I'm very cortisol driven, you might guess. I actually have the genes for that. And so what I found was I would put on weight very easily because of my lifestyle. I was going to sleep when I was dead. And so I started Atkins, 82. And that was the one thing that I always felt great, and I didn't have to worry about my weight, and I could keep the fat off. Okay. I'm going to tell you that one of the reasons I really enjoy this particular talk, and I'm going to start with longevity. Longevity is a marketing term. Okay. Wellness is what we're talking about, right? Now, I would tell people at Fountain, my goal for you is to die as young as possible at an old age. Yep. So, 120 years old, a horrific skydiving accident in the afternoon after you made love to your significant other in the morning. That's kind of what we want, right? So that's the goal. But just to let you know, my grandmothers lived into their late 90s. My grandfathers into their mid and late 80s. No Alzheimer's disease, no heart disease. So 5 years ago, I do my genetics. And if you guys ever done whole genomic sequencing at all? Okay. I would tell you, we know about 3 to 3.5 billion genes exist. We've probably sequenced 350,000. We know what about 120,000 do. Okay. There are very, very few predeterminate genes. That means you're going to get something, right? They're predispositional. So you have your genes, and then you have your epigenome. That's everything you do to make the genes not express themselves. So you have a genotype, you have a phenotype. Phenotypes is how you express it. So I do my genes. I have the worst genes for Alzheimer's you can have. 40-time risk of that. So I have the ApoE44, I have the TOM40. Now, luckily, I have something called a Klothos gene. A Klothos gene is the memory drug. So I actually have one defect, which makes you make more Klothos. And they're isolating the Klothos protein. And what's going to happen is you're going to get in, they're doing this in monkeys right now. You get an injection, your cognitive abilities go up for 3 weeks, just from the one injection. So that's coming down the pike. Okay. So that will probably be FDA approved by, at least 10 years from now, if not earlier than that, but it's on the way. So I got very interested because the ApoE44 gene also is associated with heart disease. And again, no Alzheimer's, no heart disease in my family. That's not what my grandparents died of. And then, so I had what's called a CCTA of your heart. And I can see the soft plaque, the hard plaque. That's an AI overlay that tells you about inflammation. And I had a 35% blockage in my widowmaker called the LAD. Okay. So now I got to do something, right? I got to prevent this. So I got very interested in that. 3 months later, my dad's sister was diagnosed with Alzheimer's. My mom's 87. She obviously has one of the genes because she gave it to me. COVID happened. She's isolated. And what we found is the lack of social engagement. She started to demonstrate memory problems. Okay. Now, I recently had her start plasmalogens, which is kind of the omega-3s and things in your brain. Your brain likes fat. And she has had a very much a reversal, probably moderate cognitive impairment down to mild now. But now she can remember conversations she had at the grocery store 5 and 6 hours later. So there's a lot of things coming about. I'm going to tell you, we spent 30 years trying to get rid of the plaques in the brain, which are like scabs. You get rid of a scab, it doesn't heal the wound, right? So you want to prevent the wound. And that's where we see wellness affecting Alzheimer's. So I'm going to kind of give you a little preview of that. When I say longevity, I mean wellness. I can't guarantee longevity. If you're well, the chances are you're going to live longer, better. Okay. This is, the other thing I want to thank, I don't know if Bronson or Natalie are here. Okay. So I had to change all of my slides last night after I saw your AI game. So if I'm looking back here and I don't recognize the slide, it's because it was changed last night. And the other thing is, my dreams last night were like a Stanley Kubrick movie with lizard and monkey and pig brain. It was not settling at all, for sure. This is just an encapsulation of kind of what I've done. I was fortunate enough to go to a very small school in Missouri who had the highest rate of medical school acceptances in the state. And it was a state school. Plus, I'm Georgia public school educated, so English is a second language for me, just to let you know. So this is kind of an explanation of where we want to go here and setting the stage. Right now, low carb has a serious momentum within the longevity wellness space. We know that sugar is bad, okay? And sugar is bad for cancer, sugar is bad for brain health, sugar is bad for metabolic health. So this is kind of why the topic is actually becoming that. We're finding it is a very strong case for controlling blood sugar, and I can't see most of that now, so I'm going to kind of encapsulate it. I do better extemporaneously speaking than follow a script anyway. Okay. Now, and I'm also supposed to stay here in between. Sorry, there's too many directions. So, this, I talk in terms of low carb, obviously, is kind of a spectrum. There's all kind, we got carnivores, we've got, the people that are going to do 100 to 130 grams of carbs a day, and they consider that low carb. We have other people that are doing less than 50. I can tell you on Atkins, I was always trying to stay below 30 or 20 to be ketotic. So when we say that, it's not so meaningful, and we can talk about, being good low carb versus being bad low carb as well, especially with your wellness. Okay, so what we're always talking about is metabolic flexibility, and the concept is if for any reason you can't use your glucose, you got to be able to flexible enough to go over and use ketones or your fats. And I think it was Tony that talked about the fact that you have essential amino acids and you need protein, or you get something called kwashiorkor. You guys have seen the old National Geographic things where they had a small child with the reddish hair and the big belly and no muscle. I'll give you an example of that. I was at the Naval Academy, and there was a 2-star retired Air Force general there. And 6 months before, he had decided, he's 82 years old, he's still working at Merrill Lynch, he's still very active. He decided he was going to get healthy. So he went on a fruit and vegetable diet. And I was at the gym and he was there, and he's moving, about 10 pounds on the bench press. I am a little bit of a bro scientist. So one of the things recently I got back in more heavy lifting. So the joke is that if you are a guy and you don't bench press 250 pounds, your children essentially have 2 moms. But he was doing 10 pounds. And I was asking him about his endurance, and he said he had none. He wasn't wound healing and all that. He was eating 800 to 900 calories a day. Okay, big belly. So he has this lipodystrophy that goes with it. And that's what you see. Billy Bob Thornton's a great example of that's a genetic predeterminant. That's what people with HIV get. So you lose all your muscle, you get the big belly, you have the visceral fat, which is very inflammatory. I sent him to the sports nutritionist. This is 2003. He's on 1,800 calories a day. He's got a protein-rich diet, and he puts on about 15 pounds of muscle in 3 months, and he loses his belly, and he feels great. But he was told vegetables and fruits were the way to go. Yeah. So Very simply, all of this is about energy. Okay. And I'm not going to go into depth about that because we've reiterated that over and over. Mitochondrial health, inflammation, those are all very, very important for your wellness. This is just some evidence of where we see low carb diets having the biggest impact. Weight and body fat. You guys, hemoglobin A1C is your 2 to 3 month marker where your blood sugar is. I can tell you that we talk in terms now in the wellness industry about normal versus optimal. So if you're 5'6", I don't really consider that optimal. Now I'm going to look for other reasons why you may have it. And it could be diet. I've got clients with continuous glucose monitors on who have very strict diets who never bounce with their diet. But they walk into a familiar place and they remember their ex and their blood sugar goes to 160 because it's cortisol driven, and they can tell you when that happens, and they're riddled with anxiety for other reasons. Sometimes it's their hormones are not corrected. And so we can correct that, their anxiety goes down. Some of these traumatic events that they live through doesn't raise their cortisol as much, and they have a hemoglobin A1C that now goes down to 5.2 or 5.3, which we consider more optimal. Okay, and we're going to talk about this, but after years of following people with cardiac angiograms, the calcium score is old school. It's not really that great a test. So what it tells you about is your plaque that is calcified. That is stabilized, old, mature plaque that's not going anywhere. Well, what about the soft plaque? What about the inflammatory values of the soft plaque? And that's why the new test is a CCTA with a Clearly overlay. Okay, and the Clearly company is the one that's developed that. So it's made by cardiac radiologists. Now, recently, last year, they came out with a study through Clearly that showed that ketogenic diet did not increase the amount of plaque that was present on the CCTAs. That has been withdrawn. And part of the reason it was withdrawn is because one of the principal investigators was the chief medical officer of Clearly. And because of institutional bias, they withdrew it. It doesn't mean it wasn't a good study. It just, there were a lot of pushback that it wasn't, the integrity wasn't there that should be. And we can talk about integrity in medical research all day, right? This is an aside. Do you know when the first year it was a requirement for women to be involved in medical research, that you had to require to put them in the medical studies? 1996. So I had been a doctor for over 10 years. And so right now, this 2 years ago, do you know how much money in medical research was allocated towards women's issues? I'm going to tell you, it was mainly breast cancer is where they did it. Do you know what the percentage was? 2%. Yeah. Anybody know what the Women's Health Initiative was? Ruined a whole generation of women's health. And most of us are people that we care about, right? Our moms and things like that. So now the osteoporosis. I mean, going through menopause when you're, 40 or 50 years old and having to live the next 40 years. Well, now we've got higher Alzheimer's. In deference to Maria, she talked about hormone. We do believe that estrogen deficit plays into why there are more women that have Alzheimer's. But men have estrogen too. So I think there's more to it than that, because men's estrogen and women's estrogen are not too different, believe it or not. Men just have much, much more testosterone. I'm going to tell you that one of the things we don't do with women many times is we don't give them testosterone. Testosterone's anabolic. I'm very big on muscle, okay? And producing muscle. They make myokines. Myokines make you produce something called brain-derived neurotrophic factor. It helps your brain. So and you can make muscle your whole life. There was a guy named Walter Frontera back in the 90s who looked at on MRI scans, and he gave an 18-year-old non-lifter and 80-year-old non-lifters the same protocol. They were able to make the same amount of muscle as long as they had a protein diet. So before that, we didn't think you can make muscle after 75 or 80. You can. You can lift your whole life, and you can lift heavy. You can lift heavy. Okay, and Okay, for women, if you're scared about getting big and bulky, is that me? If you're scared about getting big and bulky, if you weigh, yeah, yeah. But I hear that all the time, and they're very scared to see the scale go up. If you replace 5 pounds of fat with 5 pounds of muscle, are you the same size, smaller, or larger? You're smaller because muscle takes up a third of the room that the same weight of fat does. So we don't care about what your BMI is. BMI is pretty close to worthless. 100 people, same BMI, 100 different people. But body composition is very, very important. So a DEXA scan, and there's facilities kind of all over the country. Now, DEXA Fit, other places, you pay $99 to $129. You can get that done. You can get your VO2 max done, things like that. So they're very important. So we want you to do those kind of things. Visceral fat, very, very important for wellness, right? If you have a pound of visceral fat, that's considered optimal, there or less. If you have 2 pounds, you go up 1 pound of visceral fat, 3 times all risk cause of mortality and morbidity. 3 times, all causes. If you have 3 pounds of visceral fat, only 3 pounds, 6 times the causes of all causes rates of mortality and morbidity. So morbidity is illness, mortality is obviously dying, okay? So one of the things we saw with this is we saw weight and body fat, glucose control, and also cholesterol, especially with good cholesterol, HDL, and triglycerides tend to go down. We do see improvement of inflammatory markers. You will hear longevity, inflammation. Okay, inflammation is going to be higher as you age. It's going to be higher if you're heavy. It's going to be higher if you have more adipose around your organs. So the idea is that we want to get that down. Well, losing weight, using a low carb diet can help with that. Also, cognition and brain symptoms. Again, this is mostly an energy issue. And the brain is 2% of your body weight and about 20% of the metabolic activity in your body. And it has to turn quickly. So if you are having trouble using glucose, which happens when we age, but you have ketones available, you can turn the dial. And that's in your mitochondrial system, the energy system, the powerhouse of all of your cells, which has been mentioned many times, right? So those are the things that we like to do. Okay, so I'm just going to go through these because many of these have been spoken about, and I think you guys are well. Having been here now and seen the talks, you guys are more up to speed than 90% of the doctors that are out there in the sick care system, okay? So and then, you know, obviously there's a good low carb, there's a bad low carb. We do see some people that are genetically predisposed to having heart disease, and you can run up their cholesterol, and it is important, although it may not be as important as your blood sugar. So if and a little bit of difference, I can tell you for blood sugar, the HOMO-IR is very important. Hemoglobin A1C and your fasting insulin, very important. We found if you didn't control for that and you put people's cholesterol down at rock bottom, something called PCSK9 inhibitors, they would still make soft plaque. Okay, we found that the thing that correlated the most with having advancement of your heart disease was your blood sugar monitors, biomarkers, and not your cholesterol. With the exception, your LDL-C, your bad cholesterol that's calculated, will make statements that that's not necessary. We don't have the answers to that completely because you can have an extraordinarily high LDL-C and live in Italy and have no heart disease, right? So we don't have that all. But if you're LDL-C and you break it down, you have small, dense particles. There's a tennis net along your blood vessels. It's called the endocalyx. So if for some reason it's inflamed, it's receptive to things sticking on it, okay? You have LDL-C, and so the small, dense BBs will get through that endocalyx. Softballs and basketballs won't get through that. So big, fluffy LDL-C is not necessarily going to cause plaque, okay? What takes that plaque there? What takes that LDLC particles there? Something called ApoB, which is a protein. So if you have a 130 LDLC, and I think optimal is a 70 to 100 is normal. Well, let's say yours is 130, but your ApoB is very low. I'm going to have a different concern. I'm not going to be as concerned. But if it's elevated and your ApoB is also very elevated, I know that that's going to lead to more plaque. There's another thing called LP little a, and you may have never had that tested, but that's a genetic predisposition to having heart disease that doesn't respond to our typical things that we do. Decreasing absorption of cholesterol, decreasing production of cholesterol. So those people, the only thing we have that is FDA approved is therapeutic plasma exchange. And that's $5,000 a session. Now you can get it through Medicare if you have very bad heart disease and you have that known. But otherwise, it's basically taking your plasma out and replacing it, sort of giving you a scrub and then putting it back in there. Okay. So when I hear things about heart disease, it's much more granular than just the typical cholesterol panels that we do. Okay. And, thank God there's people like Tony Hampton and Maria and other people that can interpret that, because most sick call doctors have never even seen it tested. Okay. So back to mitochondrial health. The mitochondria is everything. That is the powerhouse in every one of your cells. Believe it or not, improving your mitochondrial health, if you're infertile, can be helpful because it improves the energy of sperm and your ovum and all of those sort of things. Okay. So you guys have heard of NAD+. That's a cofactor that you can take that can help you produce ATP. ATP is the final product, and you take phosphate off of that and use that for energy. That's what creatine does. Creatine provides a phosphate donor for you to produce ATP. Okay, and I'm huge on creatine. Okay, I think that's a non-negotiable. In fact, my non-negotiables for longevity are going to be nutrition, fitness, right, and resistance exercise, social engagement, which is huge, caffeine, and then creatine. And I would probably put caffeine before social engagement. But those are my non-negotiables, okay? So when you talk about brain health, how does creatine help? It produces something called phosphocreatine, and that's a phosphate donor, so it allows you to produce more ATP. I'm not a big fan of NAD+. We sell it, but I'm going to tell you it's a very large molecule. It doesn't go across the cell membrane very well. Something called NR is a small molecule that is a better one to do. But there's CoQ10 helps with that. Methylene blue works in the cytochrome system to help you produce ATP. All of these can be beneficial. MOTc, a peptide, love MOTc. Okay, so that definitely helps your mitochondria repair themselves. And then also you want to get rid of the bad mitochondria, and that's something called urolithin A, so you could get mitophagy. So that's autophagy of the old cells. Okay, so all that's involved. One of the things people, and Michelle, you probably know this, but not many others, there's a certain groups of people that if they use MOTc at about week 3, they start feeling doldrums again. They felt energized, they have endurance, they feel great. Then all of a sudden it's bad. Well, there's a certain group of people that it blocks their folic acid, their folate, and their homocysteine, which is an inflammatory marker for the brain, and your blood vessels goes up. Right. So, and that one doesn't respond to just giving you methylated B vitamins. Now, how many in here know what methylation means? Okay. So I'm going to try and give you more of a layman's view of it. So your liver methylates things for you. And the most common thing we see is, I'm going to say MTHFR genes. There's a sequence of about 8 of them that can be involved, but they don't allow you to methylate as well. So if you're not a good methylator, methylation is taking your food. That's crude oil. And you got to refine it. Okay? And if you have a 4-stroke turbo Mercedes, you need 94 octane. Well, what if you're not refining it well and you're getting 87? That engine's not running as well, right? So the idea is, how do we, if you're a poor methylator, how do we get you to methylate? Well, we give you pre-methylated B12, pre-methylated folate. It's important for brain health. Okay, it's important for your nervous system. That's why we give B12 and folate to women when they're pregnant, so that the babies can develop the nervous system, right? So those are the things we look at. And if you block folic acid with MOTc, I have to give you leucovorin if you want to stay on it, or I do cycles of 3 weeks, something simple like that. But MOTc is going to be the peptide of probably 2027 in my mind, because it is so good for your energy system as far as the way you feel if you're going to do a peptide. And peptides are tools. Okay, that's not my go-to. And I also believe that you've got to fertilize the land before you start planting seeds. Okay. Ketones, again, are not just fuel. They give signals. They actually give signals for lowering inflammation, oxidative stress. And then also they kind of fill in that brain fuel gap. And quite frankly, there's some people that exist very well on just ketones. You can even take exogenous ketones and get some benefit cognitively. Do you think exercise helps with brain health? Okay, we talked about myokines. Anybody familiar with blood flow restriction? So blood flow restriction is you can put a band on your arm and your leg way up high, and you can do a short burst of exercise, mainly at a 20% of your 1 rep max, and it's like doing 80% of your 1 rep max. And you can't keep the bands on for very long, but there are studies that show you put a band on your legs, each side, you pump it up to about 140 millimeters of mercury, a little bit higher than your blood pressure, and you go for a 15-minute walk. They do cognitive testing before and after. They compare it to a group without the bands on. The group with the BFR does better on cognitive testing. So exercise is definitely a way to improve your cognitive ability. Okay. So this is, again, why was this belong in a longevity talk? I think I told you wellness is what we're talking about, and energy systems. And we do lose the ability to control our energy systems as we get older if we don't take effective action to keep them that way. Inflammation, again, that's a big one. And if you ever listen to Mark Hyman or these other people that are in functional medicine, they all talk about inflammation. And by the way, Mark Hyman was a client of mine. So I actually saw him as a patient. And I won't tell you any more about it, but I will not listen to anything else he says now. He's the biggest narcissist I've ever met in my life. Yeah, he's something else. What's that? Well, and my boss was a doctor named Helen Messier, who was an immunologist, geneticist, who was one of the originators of functional medicine with Mark Hyman. She's also Canadian, if it's possible. She's nicer than she is brilliant. And I asked her one time, I said, hey, Mark's coming. Are you excited to see him? Because they kind of grew up in the industry together. Well, he's just a good example that narcissists can do good in the world. Most damning thing I've ever heard. He came through the door. Our hostess said, hi, Dr. Hyman. Dr. Messier is really excited to see you today. First words out of his mouth, well, she wouldn't even be here today if it wasn't for me. So I can tell you, I love what he's done, but I can't listen to him anymore. I'm going to get it one person removed if I have to. So again, this is this is a friendly version. That's because it has colors, but it's obviously we want your IL-6 to go down. We want your tumor necrosis factors to go down, things like that. That's basically what we're trying to do. And that's what wellness is about. That's what weight loss is about. Now that's what's going on metabolically. I was in the orthopedic industry, right? So if you walk up a stair and you step up and you put pressure, do you know what your knees see as far as the forces? 4 times your body weight. Your hip sees 8 times your body weight. So if you lose 5 pounds of weight, that's 20 pounds and 40 pounds off of your knee and your hip. So that's why losing weight also helps you feel better, not just getting rid of the inflammation. It's a biomechanical process. Okay. This is kind of the recent data. The low carb definitely lowers inflammatory loads. Much more research is being done on this. Immunity and resilience. One of the things we can't say, of course, if you can improve your immune system, it's not necessarily going to prevent you from getting infected. But it's sure, if you have immunity resilience, that's going to make a big difference when you're exposed to things. I'm still going to recommend that you have your iodine spray for your nose if you're on a plane, gargles if you're going to do that. Those are going to kill viruses pretty immediately, those sort of things. So you can still take action to prevent infection. And don't go to Mexico. I'm kidding. I'm kidding. I'm kidding. Look, there's some incredible surgeons in Mexico, and dentists. And I lived in San Diego for almost 10 years, so I've been to TJ many times. But I've also trained with people from Mexico at Mayo Clinic, and they go back there, and that's where they practice. But I'm going to tell you, if your gut biome is tested in Mexico, you're going to have E. coli. It's endemic. It's not pathologic to you. If you're from the United States, where we see very little of it, it may be pathologic to you if you go to Mexico and get it. Okay, gut biome changes depending on what you're eating and what your environment is. It changes all the time. And we're going to talk a little bit about that because gut biome plays greatly into how you feel and how healthy you are. Here it is right here. One of the things that happens if you kind of do the bad keto, the bad low carb, is you don't get soluble fiber. Soluble fiber is a prebiotic for your gut biome. What is gut biome? There's certain groups of bacteria. There's more DNA in your bowel than there is in the rest of your body. Some of them are considered commiserate. They are helpful. They work symbiotically with you to be healthy. They protect the barrier inside your gut so that things don't get through, like your hormones that you've already used, you're trying to get rid of, that can be reabsorbed, which can make you more estrogen dominant, things like endometriosis, things like that. The other thing is that if you also have something that kills it off, then you don't have that protectiveness. So in functional medicine, if you were born cesarean, if you were bottle fed and not breastfed, or if you were sick a lot when you were young and got multiple bouts of antibiotics, your chances of having bowel problems in the future are great. Do you know that 80% of the messengers in your brain, your serotonin, dopamine, norepinephrine, that comes from your gut, not your brain? And yet we try and raise it up in your brain, but just now starting to address the gut as the source of those things. If you're vegan, you're going to change your gut biome. Do you know that vegans have a very high rate of depression? And that's because of their omega-3s that they don't get. So if they're pescatarian, they may do better. But there's a reason for that, right? So that goes into your brain health, your mood. That's the reason why we use it. If you're getting enough fats, you're getting enough protein, you usually feel good, especially if you're feeding your gut biome. So there's prebiotics feed your good bacteria. So that's going to be fermented foods, polyphenols, things like that, and your soluble fibers. So you got to have that in there. So that's why I might argue that there's definitely vegetables that are, fibrous, and as long as they're not starchy, could be good for you. So now neurologic wellness. So there was Cognition 360 that was about 3 months ago in Orlando. So this is A4M, so that's the anti-aging academy, and they called this the year of cognitive longevity. And what happens with the aging brain? We talked about it's an energy problem. So how do we keep your ATP up? And again, what happens if you have the energy, especially the ketones, and you're not using your glucose well? You can use the ketones and immediately, use your ATP to make those decisions you need. So this is, again, this is the bridge that you want. So there are some studies that definitely show strong indications of improved cognitive abilities, especially if it's considered mild. Okay. We have definitely seen research in that. It's not, there's enough heterogeneity in it, but you can talk about process of doing the investigation versus the true issues with keto or low carb. These are the things that we almost always see, is we see improvement of mentation, and there have been studies that were done with that, and improvement in these testing that we do on cognition. Now, how many of you heard of Dale Brenderson? So Dale Brenderson is probably the original guy that brought to the forefront that you could actually prevent Alzheimer's on the front end. So he has something called pre-code. So if you knew what your genetics were and you wanted to prevent those from happening, you could do that. If you already have mild cognitive impairment, you can do what's called his RECODE course. And you're going to see that there's lots of things in there that he includes. So it's genetics, it's going to be your diet, it's going to be your exercise, it's going to be your sleep. Sleep is huge for that, right? So all of those, and I think his program, gosh, I want to say it's about $70 to join, and then it's about $70 a month, and if you pay for your labs, and they do pretty extensive labs, but you get a very large report specific to you, and genetics is usually part of that. So he's kind of the father of prevention of Alzheimer's. And there's even people on YouTube that have taken their relatives through the course, and they kind of talk about it and what it means, and they're not physicians, they're just relatives of people with Alzheimer's or cognitive problems, whatever the case may be. There's another guy, Dayan, D-A-Y-A-N, Goodnow, now at the end has an E. He's Canadian, he's in Moose Jaw, he's the guy I told you about. And he has done about 15 years of study using omega-3s and to produce plasmalogens. And plasmalogens are what keep your brain healthy. And he has 15 years of data reversing cognitive problems or neurodegenerative diseases. And what he had found was this supplement was very expensive. And after trying to do this for 15 years with all this great data, he's finally approaching whatever the FDA is called in Canada to make this a prescription, because that's what they're going to do, is write you a prescription there. And other places that also can be helpful, obviously, is omega-3s. Do you know omega-3s can be prescriptive? If it's 4 grams a day for your heart and for your brain, it's a prescription. You can get it from your doctor. Okay, so it can be covered. But up to 4 grams a day is recommended in many places. There are studies where they use up to 7 grams or even more. So 7,000 milligrams. Parkinson's disease, we know that is a movement disorder for most people. We do know that if you actually use a low carb diet, you can improve that. The Unified Parkinson's Disease Rating Scale, and then subsequent to that, they have a type 3, which is the movement disorder. When they go through there, they actually see improvement of their abilities, both movement-wise and also cognitive-wise, as well as expression. Anybody in here have relatives that have Parkinson's disease or have it yourself? Okay, so this is one of the places you may notice right away the differences in the shaking. You may notice more animation. You're able to go through doors. You're able to go up and down stairs, which you may not have been before. So very important. So this would tell you that Parkinson's is a neurodegenerative metabolic disease. Multiple sclerosis. Now, we definitely have seen changes with people. There's Dr. Terry Walls. Are you familiar with her? So she obviously has Keto book. She was one of the speakers at Cognition 360. I'll tell you a little story about this. So my wife gets these books, and she was telling me about Terry Wall. And I'd heard about her, but had never seen her or anything. Of course, I didn't read the book, and my wife will tell you I don't hear well, or I don't listen well. One of the two. It's one of those two. Yeah, exactly. So she was one of the speakers. And if you look back when she was in her late 40s, she was wheelchair bound from MS. and she put herself on a ketogenic diet, and she's an active, almost 70-year-old clinician, still practicing, walking around, doing everything. So she has a great book on that. So we know that can decrease the inflammatory markers that we see. We know that inflammation attacks the myelin, the white matter in the neurologic system in people with MS. We don't know how it gets there, but we do know that it can be changed by being metabolically healthier.
What's her name?
Terry, Terry, Walls, Wahls. Yep. Oh, am I getting time?
You're at time.
Oh, I'm at time? Okay. Let me see if there's anything. Oh, there's longevity studies or wellness studies that show again. And then there are some people that you got to be cautious with when you start doing keto diets and also low carb. There are some people that have certain medications that may be impactful. If you're on blood pressure medication and you drop your blood pressure using a low carb diet, then you may pass out. We don't want that. So your doctors need to be cognizant of what's going on there, or you need to be. This is the strongest evidence that we have is mainly, glycemic weight loss, triglycerides. We're definitely seeing improvement of these other things that we talked about. These are the questions you're always going to get. What about LDL? Is keto safe long term? Do I have to give up fruits, legumes, and carbs? And I really don't care what you call your diet, as long as you're getting metabolically healthy. And I'm going to tell you there are genetic differences. Somebody may not do well keto, but they may do well low carb. And you can see that if you ever do your genomics. And these are some of the success things that we can see.
Good job, Jimmy.
Sorry.
All right.